Welcome to Thursday's IRP Seminar, yet again coming to you virtually. Today, I'm really excited to have with us Bruce Meyer. Bruce is the McCormick Foundation Professor at the Harris School of Public Policy. He is an economist and has contributed tremendous amounts to poverty research with his work both on the EITC and his work on poverty measurement in consumption-based measures of poverty measurement, along with Jim Sullivan. Today is actually a super exciting presentation for us. Bruce chaired a technical working group to look at poverty measurement, and he very graciously was willing to give us a talk about that report. And I think this is a topic that all of us are very interested in, and some of us are excited to get into the weeds and hear a lot more about. So as always, I'm going to ask you to go. Bruce is a true economist, so he's delighted to be interrupted with hard questions. Please put those questions into the Q&A, and I will channel my inner economist and interrupt him and ask those questions. And I will just add a quick personal note. I actually took public finance from Bruce Meyer when I was in graduate school, and it was actually, I think, the first introduction to the field of public finance and economics and poverty. So I'm especially honored to have him talking to us today. Thank you, Bruce. I'm going to mute myself and turn off my video and turn it over to you.
Thank you, Catherine. Thanks for the invitation and for the introduction. And it was a pleasure to teach you more years ago than neither of us wants to admit. So I should start with a disclaimer. Nothing that I am going to say or show you represents the views of the U.S. Census Bureau. I was a part-time Census Bureau employee, but as of a few weeks ago, I no longer am. The work that I'm going to describe represents the work of 25 people on the working group. And they were spread across 11 federal agencies. The results that I'm going to show you from some papers also represent the work of the Comprehensive Income Dataset Project staff and many co-authors. I should also mention that all of the results that I'm going to show you have been through the Census Disclosure Review Board. So you might sensibly wonder why a University of Chicago professor is going to tell you about a federal committee that he co-chaired. For 3 years, I was a part-time census employee, starting in February 2018, what is called a Schedule A employee. I had served on the Evidence-Based Policymaking Commission chaired by Catherine Abraham that produced the Evidence Act that you might have heard of. A fellow commissioner was Nancy Potok, who had been appointed as chief statistician in the Obama administration. You might also be thinking, I didn't know we had a chief statistician. When I told my brother this, he said, so why is it chief statistician rather than statistician general or statistician laureate? I didn't know there was a chief statistician till I met Catherine Wallman, but I knew that she was at least obliquely involved in poverty measurement. So I made an appointment to go talk with her, and I described much of the material that I'm going to show you in the next half dozen slides or so, and made the case that we should reconsider poverty measurement. I think it was about 6 months later, I got an email about, would you think about co-chairing a committee of federal officials? So no good deed goes unpunished. And that was the start of 2 really pretty grueling years to work on this committee, as well as be a professor and lead a big research project. The background for what led to this working group, the kind of material that I laid out to Nancy Potok about 3 years ago, is that there's a lot of evidence of underreporting of various income sources in household surveys. That's true for transfers, but also private pensions and many other income sources, including earnings. There's been improvement over time in our understanding of how one might be able to use administrative data to solve some of these problems. And there's been an increased availability of various administrative data sources, particularly at the Census Bureau. So these points, combined with work that Jim Sullivan and I had been doing for a long time, that showed that consumption could be used to provide useful poverty measures, and that those measures could be validated by showing that they and possible other changes to the official poverty measure could lead to identifying a population that was more deprived than that by the official income measure, also was a spur to consider alternative measures. So let me show you some of the background in more detail. This figure shows the proportional understatement of 7 transfer programs in 5 surveys. The abbreviations for the transfer programs along the top are probably mostly familiar, but UI is unemployment insurance and WC is workers' comp. And these surveys differ in their purposes, focus, and other features. The transfer programs vary from ones with some stigma to others with little, like unemployment insurance or workers' comp. And what is reported here for the years 2000 to 2012, often it's a subset of those years depending on what data are available, is the ratio of total dollars reported in the survey divided by total dollars paid out according to administrative data, with an appropriate adjustment for weighting and the intended coverage of the surveys. So the CPS, for example, does not try and cover the institutionalized. So we make an adjustment for that. So the CPS source of official poverty numbers is in light blue here. The American Community Survey, or ACS, is in gray. If you look at FSP/SNAP, for the SNAP program, you can see that more than 40% of dollars are missed in the CPS and the ACS. This is a net figure, so it reflects underreporting of recipients and overreporting of non-recipients, the latter being overreporting of non-recipients being uncommon, but there are many more non-recipients, so it adds up to a lot of dollars. And
Bruce, can I interrupt and ask a question?
Yeah.
So how do we think about the underreporting? Is it or misreporting? Is it that people simply don't know, or that they're trying to hide sources of income because they fear it will somehow mess with eligibility? Or is there any literature that would give us a sense about how to think about the nature of the misreporting?
So we have started to do a fair amount of work on that. The papers aren't out yet. There is some other work, but not a lot. I would say it's not stigma. Stigma does seem to be an influence, but I don't think it's the main story. You can see here that there's a lot of underreporting of unemployment insurance and workers' comp that shouldn't have stigma. It tends to be sources that are irregular. So you see greater underreporting of programs besides the Social Security ones that have lower rates of underreporting, as you can see in this figure. But there are some notable exceptions. Quite shockingly to me, about half of the dollars from private pensions are not reported in the ACS and CPS. That's not shown in this figure, but you can look at the work of B and Mitchell to see that. So it doesn't seem to be stigma. I think it's people, both interviewers and respondents, are busy, are rushed. They skip over screening questions, or they say no to screening questions and then don't report. One possibility that could be behind these numbers is that the surveys could just be missing low-income individuals. So you might worry about that. But the coverage of census surveys tends to be quite good. The main problem is not getting people to talk to you, it's getting them to take the time to give you a complete and accurate answer. So what this figure shows is it takes the administrative data on the universe of SNAP recipients in 20-some states over up to 11 years, depending on the state. And it examines if those individuals appear in the survey in the month that they were SNAP recipients in the state, applying appropriate weights. And 95% of those who should be in the survey are. And this is for SNAP. In terms of the implications for poverty measurement, SNAP is probably a better proxy for deprivation than measured income poverty, or at least that's what we find in our research, looking at a lot of different measures of deprivation. And the agreement between who is poor and who gets SNAP is pretty close. About 35 million people are poor, and about 40 million get SNAP. So this looks like the CPS is missing about 5% of the most disadvantaged. Applying that to the poverty rate would suggest that poverty is understated by between 0.5% and 1%. It's not uniform across the distribution. Young kids and Black males in their 20s are particularly underrepresented using this approach. And I think this is probably the best source of information on whether the surveys underrepresents the poor. Now, going back to the earlier figure, you saw that about 41% of SNAP dollars are missed. When you look at dollars here, the coverage is even higher because it's disproportionately people who get few dollars and are receiving SNAP for only a few months that are missed. So this would be very close to 100% in terms of dollars. So this under recording of dollars is almost entirely measurement error. Now, when you correct that measurement error by bringing in administrative data, and what this figure shows is poverty rates in the CPS and the SIP for 2010 using different income concepts. And in maroon, it's just the straight up CPS and SIP data. And the KID, or the gray bars, KID is short for Comprehensive Income Data Set. That's the big project that I've been working on for many years now to link tax and program data to many of the Census Bureau surveys. And the gap between the maroon and the gray is what is due to underreporting or misreporting in the survey. So we've substituted administrative data for survey data for various income sources. And in the case of two income sources, housing benefits and earnings, where we know the administrative data are incomplete, we use some of the survey reports as well. And you can see that there are big gaps. And I probably shouldn't call these poverty rates. When you change the income concept, you may want to adjust the thresholds. So what these are shares below official thresholds. And you can see that bringing in administrative data makes a huge difference. Now, this figure we produced more than a year ago. We've learned a lot about the administrative data since then. And the gray bars are going to be even lower when we incorporate the fact that the detailed earnings records from Social Security, we learned only include part of self-employment income, the taxable part, which is 92% of self-employment income minus the health insurance deduction. And we've learned how to use 1040s better to get a lower bound on a group of income sources. The base census data from 1040s is only an extract. And we've learned how to use that extract better. And so the gray bars actually come down, well, I can't report numbers till they're disclosed, but yeah, it matters quite a bit. Now, it's not only for the share of people below thresholds that incorporating administrative data with survey data matters. Policymakers and researchers use poverty measures to assess the effects and targeting of government benefits. The poverty reduction of many programs is sharply understated by the existing income poverty measures. When we look at how much higher poverty would be without various programs, we can see much larger effects of many programs with the combined survey and administrative data than we see with the survey data alone. So here we say SPM for the survey data alone, that's short for supplemental poverty measure, because these numbers are taken straight out of the annual SPM report. And then the KID poverty measure, which is our combination of survey and administrative data, you can see that for many programs, the poverty rate would be much higher without these programs, as indicated by the combined survey and administrative data than is indicated by the survey data alone. For example, SNAP, since we were focusing on it earlier, the poverty rate would be 11% higher using just the survey data, this is a number straight out of one of the SPM reports, but using the combined data, the poverty rate would be 25% higher without SNAP. So it's a big deal. So in terms of the motivation for considering measures that would use consumption data or expenditure data to assess poverty, in addition to income data. Let me show you this table from paper with Jim Sullivan from just 9 years ago. And what we look at here is we look to see how well the different measures achieve the goal of poverty measurement, which is to identify those who are the most disadvantaged. And this approach leads to a rigorous way of evaluating alternative measures by whether they identify a more disadvantaged population. So we look at a bunch of indicators, basically everything that we could get our hands on for those who are consumption poor and those who are income poor. And we're adjusting thresholds so that the poverty rate is the same under the income and the consumption measure, so that we're not looking at a different percentile of the distribution and thus biasing the comparison. And most of the other indicators of well-being, and here there are things like having health insurance, owning a car, owning a home, characteristics of the home, appliance ownership, health, education, assets. And I should emphasize that the appliance ownership information is, for example, all before consumption is measured. It's from baseline information. What you see is that the characteristics of those who are identified as poor under the different measures indicate that the consumption poor are worse off, that consumption by most indicators gets you a group defined as poor who is more disadvantaged than the official income measure. And this is also true for the supplemental poverty measure as well, though that's shown in a different table in this same table, but it's even more true for the SPM. Now, there are other motivations for reconsidering poverty measurement at this time. It's been 25 years since the National Academy of Sciences Measuring Poverty report that Becky Blank was on, and maybe Tim Smeating. I meant to look that up. That report was an important advance at the time, and I can remember reading it 20 years ago and being impressed. But there are many places where the report is, I think, supplanted by recent knowledge. And I can see the weaknesses as the profession has advanced and my understanding of the issues in the literature have developed. It is, or it was, time to rethink many of the issues. Measuring Poverty produced the Supplemental Poverty Measure, or SPM, which has important drawbacks that I should point out. You might ask, well, why do we need to rethink poverty measurement? We have the SPM. Well, SPM has the drawback that the thresholds are complicated, they're opaque, they're in the end arbitrary, but clothed in scientific language and clumsy and ad hoc at times. For example, the treatment of housing status doesn't put households that own their home outright, own with a mortgage or rent, on an equal footing. It takes there to be no unobservable differences between them at a key point. The treatment of health insurance and medical costs is not ideal. Health insurance and medical costs are mostly ignored, but partially included in ways that could be counterproductive. Specifically, the SPM assumes that someone who gains health insurance but pays some positive cost is worse off than someone who doesn't have health insurance, which seems problematic, particularly when a lot of policy is oriented towards expanding people's health insurance availability, particularly thinking about Medicaid or the Affordable Care Act. So what was the mandate of the working group? Well, it was to consider alternative measures and whether they should be produced and what those might look like. We were specifically asked to produce measures that would supplement, not replace, existing measures. So the working group was established by the chief statistician of the US. That was Nancy Potok, who had been appointed by the Obama White House, or appointed under the Obama administration. Members were subject matter experts from 11 agencies, no political appointees. The co-chairs were Carrie Leslie from the Statistical Policy Office at OIRA and myself representing the Census Bureau. But there were 3 other people from the Census Bureau who had independent votes, and this was a consensus report that we all agreed to. We had 46 meetings of 2 hours at least over 2 years. That's why I said it was kind of grueling. Many of the meetings were much longer than 2 hours, and there were a lot of subcommittee meetings and phone calls and Zooms. We issued an interim report in February of last year with a request for comments. We got almost 20,000 comments, though most of them were asking for more time. So even though people had 60 days to respond and give us comments, it was at the start of the pandemic. And we ended up taking comments that were submitted long after the end of the comment period and trying to incorporate the ideas in what we were doing. We issued a final report in January. Here's the table of contents for the report. You can find the full report at the address listed at the bottom of this slide on the Bureau of Labor Statistics website. It's also available on the census website, but it's a little bit harder to find. Let me summarize the recommendations. So a lot of the report um, a lot in the report about process is to fill in details that we did not fully lay out. And there were quite a few details that we just either didn't get to or we couldn't get consensus on and left for future deliberation and research. The poverty measures that we considered had two parts, a resource measure and thresholds. The resource measure is usually income or consumption, and thresholds are the cutoffs below which you are poor under a headcount measure. So I'm going to split things into our recommendations on resources and other topics. So we recommended an income measure that combines survey and administrative data. We recommended a consumption poverty measure. And there were a lot of recommendations on how to construct those individual measures that applied to both resource measures. Then we had recommendations on thresholds and future research. First, in terms of process, at some junctures, we didn't think we had sufficient evidence or couldn't reach consensus, so we laid out ways that those details, and in some cases, pretty major issues could be filled in. However, we felt we already knew enough that a new measure based on existing knowledge and things that we could all agree on would have sufficient merit to be published immediately as a research measure with revisions and new methods added over time. We currently take about 6 months between the February, March, April data collected by the CPS ASEC and when a report is issued in September. And we wanted to emphasize that the delays shouldn't be too much longer. The goal should be to produce something with not that much more than the 6-month lag when you incorporate administrative data, though that is pretty demanding in that you have to get the data from a lot of different agencies, and the logistics are substantial. In terms of income resource measures, the group recommended continuing with the CPS ASEC, while the Survey of Income and Program Participation, the SIP, seems to have better quality data. It doesn't have sufficient sample size to calculate state rates. Currently, the CPS or the census pools 3 years of even the larger CPS sample to obtain state level estimates. We recommended adjusting income for taxes because disposable income is closer to what generates well-being. You can't spend what is taxed away. And the EITC and child tax credit are major anti-poverty efforts that you want to capture in your measure. So that accords with what is done under the SPM. We also recommended including in-kind benefits as the SPM does. We recommended linking administrative data, and the preferred approach, when possible and supported by research, would be to replace survey reports with administrative values. The cases where survey and administrative values differ still, I think, requires additional research. And there was a recognition that there are important government benefits that we won't have anytime soon on a national basis. For example, TANF benefits and SNAP benefits. The Census Bureau now has about 30 states SNAP benefits, and in some form, the TANF benefits for a somewhat larger group of states, but not the largest states, larger number, but not many big states. So that at least in the short run, some regression modeling or other modeling of benefits for states where we don't have these transfers is going to be important, or some form of extrapolation would be needed. We also recommended that data sharing be encouraged across government agencies, and that that be strengthened. That's going to be a necessary thing to happen to make the construction of income data joining administrative and survey data entirely satisfactory. And on the other hand, we think of the showing the value of bringing in the administrative data as being a good spur to encourage federal agencies and states to work with Census Bureau and maybe other federal agencies.
Bruce, if I can interrupt.
Please.
Chris Tabor has a very Chris Tabor-like question. So he says, how should I think about the ideal measure? It seems like poverty measures are used for different purposes, and the best measure for one purpose is not necessarily the best for another.
So the purpose here is to identify the poor, to identify those that are the most disadvantaged. And it's not to administer programs or figure out eligibility. So this is all about statistical measures of poverty. So that narrows the scope somewhat, but doesn't completely answer Chris's question. We took the goal of poverty measurement to be identifying those that are the most disadvantaged, but you could have that different indicators of disadvantage would point towards different measures. In the kinds of things that we've looked at, that tends not to happen a lot. That usually, in the cases that I've seen, that the multiple indicators tend to point towards the same conclusion, but I can see Chris's point. We did consider that there's a trade-off between timeliness and accuracy, and that'll come up towards the end of the presentation, because we had some recommendations on timely measures of poverty. And if you want to get something to aid the real-time decisions about policy as we did during the pandemic, then the measures that I'm talking about so far and our official measure are not helpful at all. Because, for example, the information on poverty during the pandemic year, during 2020, I'm saying that hopefully, assuming that things will get better quickly, that we can think of 2020 as really the pandemic year. We won't have data on 2020 until September, which frankly, is pretty useless for designing policy during the pandemic. So hopefully that answers some of what Chris was after, but not, I'm sure, completely. I'm not gonna go into all the features of an ideal measure, but rather, so sorry, everyone. That was probably at my end that the internet went out. Do people have to reconnect? No. I can't.
I reconnected because I was worried it was me, but you look good to me now.
Okay.
And no problem at all. We're all well accustomed to the challenges of the virtual life.
Okay. Do I need to reshare screen? Probably.
Yes. Yeah. And I think you were, well, if you don't know when you went out, we'll tell you. Yes, right there.
Okay. So hopefully I finished answering as best I could Chris's question.
Yep. I think we all got that.
Okay. So let me say that on consumption, there really was only one choice of data set. We recommended that additional funding go to BLS to allow them to produce a measure at the state level, which would require an increase in the sample size. In some of the budget markups, there was that additional money, but I don't think it was in the final passed budget. We recommended that administrative data be incorporated where appropriate. There's less of an opportunity to do that with expenditure data, but imputing the value of housing benefits and knowing whether someone is getting public or subsidized housing is aided by the administrative data that are available, particularly the HUD pick and tracks data. On both resource measures, we recommended incorporating health insurance in at least one measure, essentially providing one measure incorporating health insurance, one without. And that recognizes the value of health insurance and that a lot of policy involves changing the availability of health insurance, particularly Medicaid and the Affordable Care Act. And we stipulated that someone should not be treated as being well off if they were sick and received a lot of health care. So we recommended valuing health insurance at the community rated value. We also recognized that there's a lot of evidence saying that those with low income do not value Medicaid at cost. That low valuation could be in part due to the availability of uncompensated care, care at federally qualified health centers or emergency rooms or other uncompensated care. That to incorporate that it's really this availability of free care would require a different calculation than what we were thinking about. But because of this lower valuation of Medicaid and other forms of health insurance by those with few resources, we felt that we should cap the value of health insurance as a share of total resources. We argued that child support paid is like a tax, so it should be subtracted from income. You don't have an issue of anything to be done with consumption there. Work expenses should be subtracted from income or not counted as consumption because they're part of generating the income that one receives. The flow of resources from car and home ownership, we argued as a form of income. If you own a home outright, you get the flow of resources from that. You don't have to pay rent, and you're better off than someone who's paying rent. And that goes back to the Haig-Simons definition of income, which would include a value for homeowners and car owners. We concluded that you shouldn't count education services received as a resource. You shouldn't subtract expenses from income based on the idea that education is an investment, not direct consumption.
Bruce, can I ask you to talk more about as someone who's doing a lot of work on childcare, could you talk more about the childcare decision and sort of in more detail about capping and how you were thinking about that or how you came to this conclusion? Recommendation, not conclusion.
So, I think the current SPM has a cap of something like you shouldn't include more childcare expenses than your income or your earnings more properly. I think the thought is that some childcare is not a work expense, and that calls for at least some cap on it.
Okay.
So that's the quick answer.
Okay.
But childcare in general should be subtracted, and I think the vast majority of childcare for workers would be subtracted out of income.
This is truly a weedy question. So how do you think about that in terms of interactions with dependent care, tax credits, and employment-based spending accounts? I'm just right. It's more complicated than just.
Fair enough. Yes.
What are you spending out of pocket? So anyway, just some questions. Yeah, I don't imagine you have complete or detailed answers.
No, I don't, and I would hope that would be something that in the process that we've laid out, that it would be worked out exactly how to do that. In order to, I can see how there's the risk of double counting, depending on what kind of tax information you have that you're bringing in to link to the survey data. And I can see that there are some tricky issues to work out to avoid things that wouldn't be quite sensible.
Yeah. Thank you.
And okay, hopefully that covers it. Now, we had a lot of trouble with thresholds. Thresholds are inherently less scientific than resources. They rely more on moral and political judgments. Many have called the exact level of the cutoffs arbitrary, including Molly Orshansky, Pat Ruggles, and Ivan Falegi, who you may not have heard of, but he's responsible for the Falegi and Sumter work on linking, and was Canada's longtime chief statistician. They have one too. And we largely left thresholds for others because we couldn't get complete agreement. I hope we'll end up choosing something that's simple and not try to justify it based on some budget for certain expenses. That's my view. There's a nice section in the report on how, the way I would put it, there's kind of a founding myth for our current thresholds. The myth being that they were arrived at being 3 times a food budget, which it turns out was an after the fact justification for a political decision based on thresholds, largely based on Wisconsin's Bob Lampman's work and what the CEA had produced to arrive at Johnson's 20% figure that they'd been using on the stump as the share of the country that was poor. And so that's described in SSA statistician or economist Fisher, his description of that in a retrospective of what drove the original choice of the thresholds suggests that it really was based on this political decision, not on the what you often hear about 3 times a food budget. In fact, there were multiple food budgets, and they chose one to get the 20% figure that they were ended up with. And I had read the Fisher discussion and then ran into another Wisconsin person, former Wisconsin person, Bert Weisbrod, who just out of the blue, when I told him that I was working on poverty measurement, told me the story about how, it had been a decision that was based on coming up with Johnson's 20% figure, not justified on the basis of how much a certain basket of goods cost, which is the conventional description of how we arrived at our poverty thresholds.
Okay, Bruce, I have to interrupt. I'm like,
yes,
you're shaking the foundations of what I thought I knew.
Yes.
Are you is it just everyone's historical memory of this? Is this written down anywhere? Like, how do we, particularly since many of us are sitting here in Wisconsin, I'm just,
So you can look at Fisher's retrospective on how it was decided
someone out there should write a dissertation on this. Graduate students from sociology or some such field. It's rife for further public discussion. I guess
people want something to latch onto. They don't want to be told that the cutoff is inherently arbitrary. People don't, but
there's a difference between arbitrary and politically motivated, right? I mean, there's a little bit of what you're saying that of course it's going to be arbitrary, but there's a distinction between pulling one out of a hat and picking one that meets a person's, political agenda. So this is obviously not my specific area, but this is fascinating. So thank you for sharing this with us.
Well, if you'd asked me 2 years ago, I would have told you the conventional
Molly
story.
Orshansky, food basket, free times, because that's what we teach and that's what we've been taught. But it's good to know we're wrong.
She did, her contribution was really the equivalence scale, which came out of her work, but it's not an equivalence scale that people these days are really keen on, but it's one that we still use.
Yeah. These things take on a life once they become. We also have one other question, which isn't mine. So what would be your recommendation for integrating informal practices and formality in the consumption data? So poor households have historically used informal tools to close the gap in consumption available from income of various types and the actual need for consumption. So I imagine they're thinking about, gifts or borrowing borrowing things from kith and kin networks and churches and all of these types of informal networks and processes.
So neither income or consumption measures are going to do a good job of capturing all in-kind gifts. Gifts of money, in principle, should be captured by both, but we know people don't do a good job of reporting gifts that they receive. There are small cases where a consumption measure is going to do a better job of capturing gifts that wouldn't be captured by an income measure. For example, my co-author, Jim Sullivan, who was the youngest in a family of 12, and he said that, growing up and as a student, he had used cars that, he received used cars every few years from his siblings. And, the flow value of that resource would be captured in a consumption measure, but not captured in an income measure. But for the most part, informality is not going to be handled well by either, though if it's informal income that you get as cash and then spend, in principle, it should be captured by both, but probably in practice, it has a better chance of being captured by the consumption measure because it's probably not likely to be reported as income, but when you pay the rent or buy groceries, you're probably going to be willing to report that you paid rent. And people are just much less sensitive to reporting their expenditures, like their rent or their spending at the grocery store, than they are their income. One of my colleagues likes to report that in a survey on sexual behavior, people are much more willing to report their intimate sexual details than their income. And so, okay, so on thresholds, let me just get my screen set up a little bit better here. There we go. So I hope that we'll choose something simple for poverty measurement, for the thresholds. One issue that we struggled over is whether to geographically adjust thresholds. And I think the common view, probably you poll a majority of people will say, oh, it's obvious you should geographically adjust thresholds because rents are more expensive in New York and San Francisco. But you want to realize that geographic price differences are very different from differences over time, in that geographic differences come with a lot of other differences across geography, and including wages, health, quality of healthcare, quality of education, and the safety net, which differs quite dramatically across geography. So let me show you some results that informed kind of our inability to come to a conclusion on geographic adjustments, despite, I think, what many would think would be an obvious answer here. So what we did is we took those who would be classified as poor under geographic adjustments that have been used by census and are used by the SPM. We also considered other geographic adjustments, and looked at who's poor with the geographic adjustment and who's poor without the geographic adjustment, holding the share of the population classified as poor fixed. And we compare whether those who are classified as poor with the geographic adjustment are more deprived than those who are classified as poor without. And we looked at 9 different domains of well-being. You can see them listed along the vertical axis or side of this figure here. And all told, we looked at 56 different measures. So we looked at different kinds of appliances, different measures of assets, different measures of food security, different problems that you could have with the home, like leaks or broken windows or electrical problems or pests, material hardship or issues like not being able to pay bills. And what you see here is that while you would have expected, if geographic adjustments gave you a more deprived population, you'd see a lot of bars to the right, most are to the left here. So 44 out of 56 measures go the wrong way, and the vast majority of significant differences indicate that not geographically adjusting gives you a more deprived population. We also did the same thing with the comprehensive income data set measure. So we're using a better income measure, I would argue, than the SPM. And things are even more one-sided, with 47 out of 56 indicators suggesting that those, and to describe it in short, in rural Mississippi, at a given nominal income, are worse off than those in New York or San Francisco. And if you look at schools and healthcare and other non-cash aspects of the safety net and wages, those are things that go towards explaining this pretty overwhelming set of results, at least to me, that things were very one-sided in this comparison. So
Bruce, could I, particularly for maybe some graduate students as well as myself, say a little, I'm still trying to wrap my head around this. So the geographic adjustment ends up making people look less poor than they are?
Exactly.
You can see my question.
Not less poor than they are, less poor
overall.
It defines it throws out of poverty people who are worse off than it brings in.
Okay, and it does that because
people
okay,
that are poor. Yes.
And I guess my follow-up question is that sort of like Southern Delta. Is that really the place that sort of does this because it has such a low cost of living?
Yes.
Okay.
It's so the areas which are, you're saying that people are better off in West Virginia and rural Mississippi and some of the plains states than they, you're saying that they're better off and people in New York and San Francisco are worse off,
right,
and Boston than they would be under the official measure.
Okay. And I realize that's like a neutral statement, but it's obviously people would have opinions on whether that is a good or bad thing for a poverty measure to do.
Okay.
You can keep going. Sorry.
So this was an issue that we had a lot of difficulty with because the common view of this seems to collide quite strongly with the evidence that we were able to bear. And this, in fact, agrees with what people at the Census Bureau had produced as well. They found this same result and didn't know what to make of it. And I think that they were so convinced that you wanted to geographically adjust that they just kind of rejected the whole notion of empirically testing the idea, which is I find frustrating. There were some recommendations for future research that we had. There was a lot of sympathy among the group for multidimensional measures, and many people thought that we should try and recommend a multidimensional poverty measure, but we concluded that since we were having trouble with unit dimensional measures, getting universal agreement on things, it was too much of a lift and a future group should take it on. We noted that the homeless aren't covered in standard surveys and that should be more clearly acknowledged in Census Bureau publications, and that the impact of the omission of the homeless should be noted in terms of the rates, and research should be conducted on this overlooked population. We noted the lags in poverty measurement as a problem that already came up earlier. We won't hear about last year until 6 months from now. On the other hand, Jim Sullivan and Ji-Hoon Han and I have been releasing poverty that's clearly going to be less accurate, less comprehensive, but based on Census Bureau data with just a few weeks lag, and it seems to be very highly correlated historically with the official measure with all its drawbacks. we concluded also and wanted to emphasize that one of the advantages of moving towards income measurement, joining survey and administrative data, is that it could reduce the burden on respondents and allow potentially obtaining higher quality responses to non-income questions and maybe even adding additional non-income questions if you can replace some of the income questions with administrative data. So the broader effort of bringing in administrative data to supplement survey data would have many valuable benefits for research, allowing the better evaluation of many transfer programs. Similarly, expanding the consumer expenditure survey to allow measurement of poverty at the state level would allow more work to be done using the consumer expenditure survey. We're busy, my research group, trying to examine options for filling in some of the details of the poverty measures we proposed and for validating the methods as well. So let me stop there. I didn't leave much time for additional questions.
That's okay. We have a minute if folks want to put something into the chat. I can tell you that Tim Smeeting, who almost certainly would have had something to say, got in touch, texted, emailed me to say that he had to run and do something with his son, but that he was very sorry, appreciated your talk, and he wanted to call attention that there's a National Academies, I think it's National Academies committee that our own Bobby Wolf is on, currently meeting on how to revise the supplementary poverty measure. So he wanted to bring that to people's attention. So Bruce, I have a question for you. What do you think the odds are of actually being able to bring in administrative data and make it match to surveys in a way that people can readily access and use it? I mean, I always have the fear that it will get put behind so many firewalls that it'll be very hard to use.
Well, the intention is for more availability, and more people have been accessing these linked data than have been in the past.
Okay.
I think of producing this kind of a measure and the research that my group is doing as building the case for access.
Okay.
You know, if I think it shows that there's a lot of value to the linked data, and I hope that researchers will demand access because of its usefulness.
Yeah.
I think it's a complicated setting now in terms of trying to get greater availability. I don't know if you've heard that even within census, the 2020 decennial census is going to be largely off limits.
I had not heard that.
Yeah, so it's so there are increased restrictions in the ACS. There's going to
I have
be
heard that. Yeah, I have heard that.
more restriction on what you can get from the ACS. So this at least has been moving towards more availability for researchers. Mm-hmm. But that's something that I'm very interested in seeing happen, and I hope that others will be pushing for greater availability.
Yeah, I think we all feel strongly that for research purposes with appropriate security and precautions, but it's...
There's been a growing number of research data centers.
Yep, we have one.
I noticed that
Yeah, we do.
yeah. And so that's a positive step. I mean, a few are being added every year.
Yep.
One or two really
Yeah.
are being added every year. And their use, I think, has been going up pretty sharply.
Yeah. Well, we are 2 minutes over time. I really, as you can tell, I learned a lot, and I'm sure everyone else listening did too. We look forward to seeing you in the future when COVID is gone, and continuing to hear about this work. It's really exciting and important, and foundational to thinking about and researching poverty. Thank you, Bruce.
Thank you. Pleasure to get the chance to talk.
Be well.
You
Bye.
too.